Hello and welcome. I'm Dr. Dalton Norwood, scientist in the Division of Preventive Medicine in the University of Alabama at Birmingham. Today I'm joined by Dr. Shajan Peters, distinguished professor of medicine in gastroenterology. Together we're excited to guide you through our study that is reshaping the approach of enteral nutrition, offering new insights and solutions for patients in need. Dr. Peters?
Hello, on behalf of all our authors, we are pleased to present our recently published article in Gastrointestinal Endoscopy titled Safety and Efficacy of Direct Percutaneous Endoscopic Jejunostomy Placement, or direct PEJ, compared with surgical jejunostomy.
Welcome, Dr. Peters. It's a pleasure to have you here. Our study on direct PEJ versus surgical jejunostomy has gathered quite a bit of interest in the last couple of weeks. Let's start with the basics. What motivated you to embark on this research?
The motivation stemmed from a critical need to improve patient outcomes in enteral nutrition. We noticed a gap in comprehensive comparisons between direct PEJ and traditional surgical methods. Our goal was to fill this gap, providing clear data on efficacy, safety, and cost effectiveness to guide clinical decisions.
Excellent. Dr. Peters, can you tell us a little bit more about the methods that were put in place to execute this study?
We examined cases over the last 5 years at our institution that had an enteral tube feeding placement. We further divided the group in traditional open jejunostomy, laparoscopic jejunostomy, and direct PEJ procedures. We focused on procedural success, defined as a successful placement of a functioning jejunostomy tube on the first attempt, and monitored for both early and late post-procedural adverse events.
Amazing. Dr. Peters, can you highlight what are the key findings from this study comparing direct PEJ and surgical jejunostomy, and what's their significance?
Absolutely. Our study revealed notably a high success rate of 96.9% for direct PEJ, which is quite comparable to surgical methods. Additionally, direct PEJ proved to be generally a safe procedure with minimal complications such as low incidence of bleeding requiring transfusions, perforation, and infection rates akin to surgical approaches.
Amazing. Dr. Peters, considering the healthcare cost and patient recovery, how does direct PEJ compares to traditional surgical jejunostomy in terms of cost effectiveness?
Notably, the cost for outpatient direct PEJ is significantly lower than for surgical alternatives. In 2021, Medicare's estimated cost for outpatient direct PEJ was approximately $1,800 compared to $5,700 for outpatient laparoscopic J, presenting a cost-effective solution in an era of rapidly rising healthcare costs.
Wow, that's an amazing difference. Dr. Peters, what are other advantages of the PEJ compared to traditional methods?
Direct PEJ eliminates the need for additional abdominal incisions, which potentially reduces post-procedural complications and enhances patient recovery.
Indeed, and our findings were quite compelling. In your view, what does this study add to the existing body of knowledge in gastroenterology and enteral feeding practices?
Our study not only reaffirms the high success rate of direct PEJ, but also highlights its safety profile and cost advantages. It challenges the traditional preference for surgical interventions, suggesting that direct PEJ could be a preferable first-line option for many patients in the future.
That is an important point. With the insights we have gained so far, what do you believe should be the next steps in this line of research?
The next logical step would be to conduct a prospective study, possibly a randomized controlled trial to further validate these findings. Additionally, exploring patient quality of life and long-term outcomes post-direct PEJ could provide deeper insights into its benefits over surgical methods.
Well said. As we wrap up, any final thoughts or messages that you would like to share with our viewers, especially those in the medical community?
I would like to emphasize the importance of staying open to evolving practices and technologies in medicine. Our study is a testament to the potential of innovation in improving patient care.
Amazing. Thank you, Dr. Peters, for this enlightening discussions. Thank you for GIE to allow us to present our article, and to our viewers for joining us. We hope that these conversations provides valuable insights into our study and its implications in future of enteral feeding. Thank you.
Thank you.